Hello everybody, my name is Dr. Fazil. Today we are going to talk about polypharmacy, or patients taking multiple medications for different things. And a lot of questions I do get asked in my encounter with the patients: what can they do to reduce the medication? How can they take less medication every day to get the same beneficial effect? Welcome to Dr. Fazil May 2022 TV show. As most of my patients know, or the relatives of the family, or relatives or the family members of the patient have observed that a lot of patients are taking multiple medications, like some of them taking dozens of medication every day. Now, most common question I've been asked, among other questions in my encounter with the patient, is what can they do to take less medications? That's a legit question, because that's a whole full-time job to take medication every day. In a timely fashion, these medications are expensive. Although they have a benefit as well, we know that the medications are given for a reason, but they also have side effects. So they say all medications are poisons and all poisons are medications. It's just a difference in the dose. So having said that, we know medication have side effects. And sometimes I've seen that patients are seeing multiple doctors. Sometimes there are miscommunications. One doctor wouldn't know what the patient is taking, or patient wouldn't know what he or she is taking. And it sometimes causes duplication of medications, or it causes unnecessary medication burden on the patients. One way to avoid it: first fix update your medication list. We call it a brown bag day. So what the brown bag day is, that we ask the patient to put everything in all the medication which you take in a bag and bring it to the doctor that day. And in that way we can update all the medication. Historically, their list of medications is generally not accurate. They go to the hospital, the medication get changed. They go to another specialist, the medication got changed, but they never get updated on the list the patient generally carry. So the only way to get the accurate information is to get the medication in front of the doctor physically, and then we can see what are the duplicate medication we can get rid of. There are some unnecessary medication which patients don't need to be on, that could be stopped, or some medication which should have been on, we can add on to those, we can prescribe those medication. So that's a safe way of practicing medicine. Okay, so this is one portion of the equation, one portion of the problem. So let's look at the typical medication cabinet of the patient. And here it is. You can see right here, this is the cabinet. I'm expanding it to you, and you can see how many medication patients have to take on a daily basis, right? So this is a rat poison. We'll also call it Coumadin, and both are the same thing, just the dose is different, remember. So overdoing Coumadin or warfarin can cause a lot of fatal problems: bleeding, death, and other complications. So dosing is important as well. It's not just what you take, but what dose you take at the same time. Plus there's another thing known as drug interaction. A lot of time you have drug interaction. Some medication would not work with some foods wouldn't work with some medications, some medication would not work with each other. So we also have to educate patients and the family members what medication they should avoid, or food they should avoid with certain kind of medication. For example, if you're taking warfarin or Coumadin, you should not take certain kind of green vegetables, because it has too much vitamin K. It can antagonize effective vitamin K, can antagonize warfarin. Or a certain kind of antibiotics, for example, they can cause interaction with warfarin or Coumadin, which is a blood thinner, and cause the level to be dangerously very high and cause fatal outcomes. So drug interaction is also very common cause of complications. So drug interaction is a very important factor as well. Sometimes the right hand doesn't know the left hand, sometimes the left hand doesn't know the right hand. So it's a teamwork between the providers, the patients, different specialists, as well as the family members to work together as a team so the patient gets the best treatment possible. On another scenario, what can we do to reduce the overall burden of the medication? So we talked about, okay, patient is taking medications and we're not aware of that. What medication patient is taking, that might be due to duplication of medication. We also talked about it is important to educate the patients what medication they need to take because there's some interaction between certain kind of foods and medication. Sometimes there's interaction between different kind of antibiotics and medication or medication. For example, if you give Cipro for urinary tract infection who has been on warfarin or Coumadin, which is a blood thinner, it can raise the level of the warfarin to dangerous levels. So it is important for the patient to let the provider know what medication they are on so they could be careful.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Falzon Show channel and add it to your home screen. View our videos online by visiting our website at www.drfalzoshow.com. Our videos are available on YouTube by searching for the Dr. Falzon Show. And don't forget to subscribe to our channel. The Dr. Falzon Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
Certain kind of kidney transplant medication can also be, they have a lot of interaction with other medication as well. So we have to be very careful if somebody have a kidney transplant, that when we prescribe medication, a new medication to that person who have a kidney transplant, that medication does not interact with the anti-rejection medication what the patient is on, because that can cause the levels to be either too high or too low, and it can cause the rejection of the kidney and the patient can end up on dialysis. So it has grave consequences. It might seem a minor thing, but on the long run, in the real world, those small steps could cause dangerous outcomes. So it's very important to keep the providers updated what medications the patient is on by various means. The best way is to bring medication in person. Every visit, bring the medication in person, put in the bag, bring it with you. That's the best way to do it, if you can do it. List might be okay, but not most of the time. As I said, the list mostly is not very accurate. Just keep changing. Now, few things we can do to reduce the medication burden. Let's say we have all the accurate information. Well, that's how we start, because now we can see patient is taking a duplicate medication which can be easily stopped. So that's how you start reducing the medication burden. Sometime that medication was important at the time when patient had a certain conditions, and now it's not important anymore. So we can stop and give you example. If somebody have a heart attack and have a coronary stent, a stent in the heart, like you can see, this is the heart, and we are here's the stent. And after the stent, we have to keep the patient on anticoagulation with Plavix, which is kind of a blood thinner for for up to 6 months to 1 year. After that, we can stop. So let's put the heart on the side. So now you see that a lot of patients, sometimes they did not go back to the cardiologist who put him or her on that medication, and they did not need that medication, but they're still on it. And that medication can be now stopped. But that is just because the patient brought the medication in, the doctor went through the medication reconciliation process and got rid of some unnecessary medication. Not only it will decrease the cost of medical care, but also will provide unnecessary risk, which could be bleeding as well as drug interaction. Okay, let's talk about a few of the medications which could be stopped. As we lose weight, a lot of medication can be stopped. The root of all evils is being overweight. Obesity is cause of hypertension, type 2 diabetes mellitus, sleep apnea, arthritis, joint pain, back pain, hypercholesterolemia or high cholesterol, gout, and there's a lot more other medical conditions, but these are the big ones. So if you start to lose weight, and people do lose weight under certain circumstances, either they lose intentionally or unintentionally, then your sugar might drop. And what happens is that when the sugar is dropping, instead of taking less medication, people eat more food so they can keep the sugar up. What has happened here is that we should actually reduce the medication dose or stop that medication, because patient does not need that medication anymore, because patient have lost weight. So that's how we can reduce the medication, and patient can also keep losing weight instead of having a looping effect where you're losing weight but your sugar drops, and then you eat more, you gain weight, and then you go on and on. So that is important. Small things does make big difference in medical care. Same likewise, the blood pressure medication. So the blood pressure medication, as you lose weight, we can also lower it or even stop it. Same thing for the cholesterol medication. If you lose weight, your cholesterol drops. If you change your diet, we can check your cholesterol. If it is normal, you don't have to take that. So we can get rid of your blood pressure medications, diabetic medications, as well as cholesterol medication. And here's another example. So I can see this is a spine, that's a hip joint. Let's expand the hip joint like this, and you can see the hip joint. You can see here, this is the socket of the hip joint, and this is the femur or the ball of the hip joint. And you can see there's the bone spurs, and this is have developed osteoarthritis, right? Why this osteoarthritis happened in the first place? It happened because the patient is overweight. When you put too much stress on the joints, they will burn out fast, right? So if you have lost weight, your arthritis progression will stop. And the medication for pain which you're taking, you might not need to take it. Let's put this thing on the side for a moment, and let's talk about what else can we do to decrease the medication load. Sometimes we give one medication for a benefit, then we give a second medication for the side effect of the first medication. For example, you are overweight and you have gained weight, and that causes back pain or pinched nerve. For pinched nerve, we give medication like gabapentin. That causes constipation. For constipation, we give a constipation medication. So now we're giving a medication for a side effect. So now you have two medications, right? Now, because you gained weight, your blood pressure has gone up, you took a medication which caused some swelling in the legs, like Norvasc or Namlodipine have a side effect. Then you take a water pill to get rid of their swelling. So we have now 4 different medications for one problem that could be solved by reducing weight, right? So if you lose weight, you wouldn't have a back pain, you wouldn't need the gabapentin. If that goes away, your constipation will go away, you would not need a constipation medication. You also have lost weight, your blood pressure has dropped, so you would not need a blood pressure medication. If that goes away, your swelling will go away, you would not need the water pill. So it's like a chain reaction. One thing leads to another. It's a chain reaction, like a house of cards. One falls, the whole thing falls. That's like a house of cards. One card falls, the whole thing falls, right? So this is how we can do it. So again, today my goal was to educate our audience, our patients, that what can they do to live a healthy life with less medications, safe medications, and also have less side effect at the same time. So step number one, do bring your medication with you every time when you come to see your doctors. Not the list. I would recommend medication bottles in the bag so the doctor can see it. By doing that, we can reduce the duplicate medications or medications you don't need in the first place. You might need it in the past, but does not need now. That could be stopped. That's one way of doing things. The second thing is readjusting the medication. The medication you don't need might need to lead to another medication which you might not need because you don't have side effect of that medication, the first medication which you're taking. Now you don't have side effect since you stopped, then we can stop the second medication as well. The last thing is please lose weight. As I said, obesity or being overweight is the root of all the problems. If you're overweight, you will have less life expectancy for various reasons, but most big medical complications of being overweight is hypertension, high blood pressure, diabetes, sleep apnea, high cholesterol, arthritis, and again, remember, these are not just few medical conditions, they have further consequences. High blood pressure, diabetes, and cholesterol will cause stroke and heart attacks, and they could be sometimes fatal as well. So we are who we are what we eat, okay? So basically we are what we eat. So watch what you eat and bring your medication with you. When you see your doctors, believe me, you would be surprised how many medication we can get rid of from your daily list. Thank you, and thank you for watching Dr. Fazil Show. I hope my information was useful to my audience, and stay tuned. I'll be back next month with more useful information so you can have a better life. And God bless you all. Thank you, Dr. Falzon.